Good morning and welcome to Advent Broadcast Network Weekly Church News. We're going to be covering a number of stories and I'll highlighting them in today's segment. Stay tuned to the end. I will be your host for today, Jane Mwena. Southern Adventist University Enactus team places third in national competition. The Southern Adventist University's Enactus team placed third in the nation at the Enactus United States National Exposition. Housed in the School of Business, the student team has previously ranked second in their league several times, but this is their first time to advance through to competitions to the final round, which included the top 4 schools in the United States. Enactus is an international non-profit organization that brings together students, academic and business leaders who are committed to using the power of entrepreneurial action to improve the quality of life and the standard of living for people in need. Guided by academic advisors and business experts, the student leaders of Enactus create and implement community empowerment projects around the globe. This year's exposition included 98 schools across the United States, but due to COVID-19 pandemic, the competition took place virtually. Each competing team submitted a 12-minute video and annual report to show why their projects are sustainable long-term and how they will have the most positive impact on the lives and communities around them. Enactus also honored Docom's assistant professor in the School of Business and Southern's Enactus sponsor with the 2021 Sam Walton Fellow of the Year Award for her leadership contributions to the team and investment in the students' lives. This was reported in the Southern Adventist University website. Advent Health Wesley Chapel and Advent Health Zephyrills are recognized among the nation's best by Health Grades. Health Grades recently released its 2021 America's Best Hospitals designation, and Advent Health Wesley Chapel and Advent Health Zephyrills were among the honorees. In all, 9 Advent Health hospitals were recognized. The America's Best Hospitals Award recognizes superior performance in 32 of the most common conditions and procedures. Only 250 hospitals nationwide received the recognition, and Advent Health Wesley Chapel and Advent Health Zephyrills were the only hospitals in the Tampa Bay area to be honored. Patient safety and high quality of care continues to be the priority, and we are honored to receive this recognition, said Eric Wangnes, President and CEO of Advent Health Wesley Chapel. And he continues to say that this award is a testament to the hard work of our physicians and team members who are committed to keeping our patients safe during the COVID-19 pandemic and each and every day. In naming the honorees, Health Grades evaluated nearly 4,500 hospitals across conditions and procedures like heart attacks, stroke, heart failure, and sepsis. Facilities earning the America's Best Hospitals distinction sit among the top 5% of those assessed by Health Grades. Clinical excellence is at the core of our care, and this distinction highlights our ongoing commitment to providing our expertise to every patient every time, said Amanda Maggard, who is the president and CEO of Advent Health Zephyrills and Advent Health Dade City. This prestigious honor celebrates the dedication of our teams who continue to go above and beyond to ensure our communities are receiving the best care possible and experiencing better outcomes, she added as she concluded. ADRA Connections trip helps bushfire-affected communities. For the very first time since COVID-19 restricted travel, ADRA Connections Go Local trip took place from April the 12th to 20th. The Go Local trip saw 7-year, 12 and recently graduated students and 4 staff from Prescott College Southern in South Australia visit Kangaroo Island to help with bushfire recovery efforts. In December 2019, bushfires ripped through the island, burning nearly 50% of the land. Though the fire was declared safe on February 6, 2020, recovery efforts are still taking place across the island, and the community will continue to heal for years to come. The students spent their time on Kangaroo Island helping local farmers and residents with tasks like replacing burnt fences, weeding, and general garden maintenance. Altogether, the students removed 32,000 blue gum seedlings. Over a year has passed since the bushfires ravaged the island, but the impact on the people and the land are still tangible. The resilience of the locals was a key takeaway for the students. By serving people in their own backyard, the Connections Go Local trip left an impact on both residents and the students. And one of them says it is crazy how doing something so small can have such a big impact on others. Joel Slade, South Australia Conference Youth Director, said. God is seen in action in Costa Rica. It is Rita's first mission trip after the lifting of pandemic restrictions brings inspiring results. In March 2021, it is written a supporting ministry of the Seventh-day Adventist Church conducted a mission trip in Costa Rica. The group went to a small countryside town called Las Huantas in Abagarin's Canton to build a church, run medical clinics, and hold evangelistic meetings. Members from churches in Tennessee, California, and Washington in the United States, along with teachers and students from a church academy from Greenville, Tennessee, and even it is Rita's own evangelism assistant Maria Rayburn and her 12-year-old daughter Gabriela joined the mission trip. After months of planning, volunteers were beyond excited for the trip. After a 4-hour flight, the team members landed safely in Liberia, Costa Rica, and quickly removed their sweaters. From Liberia, the team traveled to Las Huantas, and where the howlers monkeys greeted them in the trees right outside the hotel. Morning came quickly courtesy of fruit bats outside the hotel windows. Shortly after breakfast, the team started work at the church building site. Some moved dirt, while others raked to level it out. They leveled the foundation and began building walls. The work required a compactor to complete the floors, but there was nothing available to rent in the entire country. So the team prayed. The local pastor was driving to another town to see if he could find a compactor when he happened to see one in someone's yard. He stopped and asked the owner if he would rent it, and the owner accepted. The sun was extremely hot, with temperatures usually above 90 degrees Fahrenheit, that is about 32 degrees Celsius, and the team was grateful for the daily lunch served at the church elder's home. Next to his home is a small hut with a thin roof that serves as a local church. The local church community was extremely grateful for the work put in by the mission volunteers to build an actual church building. Every night, the group split up into small groups to do evangelism and maintain social distance. Maria was able to translate the meetings from English into Spanish. The volunteer students gave a health talk, told children's stories, and shared a sermon they wrote from their daily study in Steps to Christ. At one of the meetings, 4 children stepped forward in response to an appeal inviting Jesus into their lives and hearts. During the day, Another part of the team held free vision and medical clinics. The missionaries saw almost 750 patients, dispensed hundreds of pairs of glasses, and helped many people with joint pain and general health challenges. Patients were given steps to Christ in Spanish and invited to the evening meetings. On one particular night, shortly after the evening meeting finished, a church member came to the physician Gordon Guild and said she was feeling unwell. After Guild examined her and believed she might have had a bad minor stroke. So Guild and the rest of the team prayed for her that night. By the following morning, she was feeling much better and she was back in the kitchen. Toward the end of the trip, rain was predicted just before the church floor needed to be poured. The students worked hard to complete their prep work before the rain moved in, and then they started praying. The following day, God held off the rain. It rained all around the team, but not at the work site until the floor was poured and walls finished. And then the heavens let loose. As the rain fell, the team reflected on the power of the Holy Spirit that had also been poured out during their time in Costa Rica. The people who had attended the evening meetings now had a place to worship. Pain had been relieved, sight given, and hearts had made decisions for eternal life. This was a mission trip for eternity, and the Lord worked in a miraculous way. In India, ADRA ramps up relief efforts as the mounting COVID-19 health crisis. The Adventist Development and Relief Agency, ADRA, is scaling up emergency operations in India to save thousands of lives in COVID-19 affected communities. The country is struggling with an unprecedented second outbreak of COVID-19, with more than 350,000 new coronavirus cases daily, according to the World Health Organization. Over 208,000 people have died in India since the beginning of this year, and the numbers are subject to change daily. ADRA's emergency response team is working on the ground to ensure COVID-19 critically ill patients have immediate access to oxygen to survive the crisis. The International Humanitarian Agency is donating an oxygen generation plant, an OGP, to provide relief to affected patients. The situation in India is grim. The hospitals are running out of equipment to keep people alive, such as oxygen cylinders. The healthcare system is stretched to the breaking point, and people are dying because they can't find a hospital bed and oxygen. It is absolutely terrible. The country needs immediate help, says Weston Davis, who is the ADRA country director in India. ADRA is partnering with Adventist hospitals, the Adventist Church, and other trusted partners to establish the on-site oxygen generator plant. The life-saving gas system will provide COVID-19 patients with a secure and constant source of oxygen, instead of relying on manufacturers who cannot meet the demand due to the massive surge in coronavirus cases. ADRA is also working with the region's health department to help set up and monitor COVID-19 vaccine camps, and is teaming up with the mental health facilities to offer psychosocial support through counseling and community awareness programs. Additionally, ADRA is delivering critical PPE to frontline health workers who are in the hospitals in the country. South New Zealand Pathfinders unite for ANZAC Day March. For the first time in recent history, every Pathfinder club from across the South New Zealand Conference was represented at a single event, with more than 180 Pathfinders joining together for a Pathfinder Rally Camping Weekend, which finished with a day march. Beginning on Friday evening, the 23rd of April, the clubs set up camps at Pasco Park, Christchurch, and were awoken on Sabbath morning for a parade at 8:30 a.m. that led to a church service at an amphitheater on site, followed by Sabbath school at their tenting sites. The theme for the weekend was Find Your Path, with guest speakers Lance Bolton, South New Zealand Youth Director, and Mervyn Brown, Youth Leader at the Fijian Church, presenting talks with theatrical flair that engaged the Pathfinders. On Saturday night, the Pathfinders finished their program early with hot chocolate and biscuits in preparation for the wake up at 4 a.m. to attend the Christchurch ANZ AC dawn service. 4 buses arrived at 4:45 a.m. and Pathfinders and district directors boarded. The Pathfinders were joined by 21 adventurers from the Fijian Church as well, bringing the total number of people marching to more than 200, which was a great testimony. 125 Europe-bound children rescued off Libyan coast. The United Nations Children's Fund highlights the dangerous plight of migrants, including children attempting to reach Europe via the Mediterranean. Last week alone, 125 children were among those rescued at sea off the coast of Libya. According to UNICEF, the central Mediterranean continues to be one of the deadliest and most dangerous migration routes in the world. Since the beginning of the year, at least 350 people, including children and women, have drowned or gone missing while trying to reach Europe, including 130 the other week. UNICEF said in a statement on Friday last week, another 125 children, 114 of them unaccompanied, were rescued at sea off the coast of Libya. Despite these dangers compounded by COVID-19 pandemic, refugee and migrant children continue to risk their lives in search of safety and better life, UNICEF said, expressing concern that attempts to cross the sea route are likely to increase during the summer months. UNICEF highlighted that the majority of the rescued children fleeing situations of conflict, war, and poverty have been sent to overcrowded detention centers in Libya under extremely difficult conditions and with no or limited access to water and health services. Currently, nearly 1,100 children are in these centers, the statement noted. On this issue, UNICEF urged Libyan authorities to release all children and to put an end to immigration detention. It also called on authorities in Europe and the central Mediterranean to receive and support migrants and refugees coming to their shores and to strengthen search and rescue efforts for those lost at sea. Libya has 51,828 migrant children and an estimated 14,572 refugee children. Most are unable to access services and are vulnerable to exploitation and abuse within the country. Worse still, those in detention are cut off from clean water, electricity, education, healthcare, and adequate sanitation facilities. Violence and exploitation are rampant. UNICEF therefore reiterates its commitment to support all governments across the central Mediterranean to find safer alternatives to sea crossing, develop and implement child-sensitive arrival procedure, reception and care facilities, and long-term solutions for children attempting to cross the sea. The detention of children in migration contexts is never in the best interest of children, UNICEF insists. The first batch of U.S. aid lands in India as the country still battles coronavirus surge. Planes carrying the first emergency U.S. aid arrived in India's capital on Friday amid another increase in coronavirus cases in the country. With 386,452 new cases, India now has reported more than 18.7 million since the pandemic began, second only to the United States. The health ministry also reported 3,498 deaths in the last 24 hours, bringing the total to 208,000. Experts believe both figures are an undercount, but it's unclear by how much. Health Minister Harsh Vardhan expressed hope that assistance being sent by over 40 countries will plug the shortage in medical supplies. The United States is sending more than $100 million worth in items, including 1,000 oxygen cylinders, 15 million N95 masks, 1 million rapid diagnostic tests. Japan Friday, it will send 300 ventilators and 300 oxygen concentrators in response to the Indian government request. France, Germany, Ireland, and Australia have also promised help, and Russia sent 2 aircrafts carrying oxygen generating equipment. The India Air Force also airlifted oxygen containers from Singapore, Dubai, and Bangkok. Four people are held in German-led raid on huge network. German police have arrested 3 men and a 4th is being held in Paraguay for allegedly running one of the world's biggest online networks for sharing images of child sex abuse. The international operation, involving several police forces, targeted a darknet platform called Boys Town, which has now been taken down. Officials say Boys Town had more than 400,000 registered users. They say some images showed the most serious sexual abuse of young children. The dark net is an internet area beyond the reach of mainstream search engines. The German-led investigation involved law enforcement agencies in Netherlands, Sweden, Australia, and the US, and even Canada. The EU police agency Europol says it will also examine intelligence gained from the operation, and more arrests and rescues are to be expected globally on this basis. Several related pedophile chat sites on the dark net were also dismantled, Europol says. German police says 3 men detained since mid-April are believed to have run the pedophile network, one aged 40 from Paderborn, one aged 49 from Munich area, and 58-year-old from North Germany, who has been living in South America for several years. He was detained in Paraguay's Concepcion's region under an international arrest warrant, and German authorities have asked for his extradition. The 4th suspect is a 64-year-old from Hamburg who was allegedly one of the most active members responsible for more than 3,500 posts. Lebanon battles swarms of locusts after wind changes direction. Army helicopters are spraying agricultural land in northeast Lebanon to help farmers battle swarms of locusts that flew to the country in what the United Nations agency said was a very rare event caused by a change in the wind direction. The Agriculture Ministry, which is on full alert, said on Monday large numbers of locusts have been destroyed. There have been no big farming losses so far, but there are concerns that more swarms could be blown to the south of Lebanon. Caretaker Agriculture Minister Abbas Mortada told the Reuters. The locusts, which threaten crops, are the latest addition to a long list of challenges faced by Lebanon, which is battling its worst financial crisis in decades. The United Nations Food and Agriculture Organization, FAO, said the occurrence was unusual in the area, but that a change in wind direction had blown the locusts in from Saudi Arabia to Jordan and onward to Syria and Lebanon. It is a very rare occurrence. The breeding grounds were on the Red sea coast, Saudi Arabia's northern coast. So they were blown in through Jordan and Syria. But so far, it is under control and certainly nothing to be panicking about. And that brings us to the end of the news segment today. Thank you so much for staying tuned to the end. Do not forget to like the video, leave your comments, and also share. And if you can, head on to our YouTube channel and press the subscribe button. Looking forward to seeing you again next time. I have been your host for today, Jane Mwena.